Okay, here we have the picture for myocardial infarction. Or MI. Either way, we're going to start with, clinically. You've got a guy who's, got a weak pulse, dyspnea, can't hardly breathe, diaphoresis, he's, sweating. He's clenching his heart. He's got a crushing substernal chest pain. It radiates to the left jaw or the left arm. Here he's holding the Q wave. You got a Q wave in the transmural infarct. Okay. Now, guy leaning forward and holding his chest is called Levine sign. So just in case it shows up in a question, Levine sign. Okay, that's the you got two types. You've got transverse mirror. See, transversing the mirror, transmural. That's got the Q wave. You got submarine or subendocardial. Okay, subendocardial. So there's two types, and you get those clinical manifestations from that. And there's things you might want to look at. You might want to check troponin levels. That the troponin can show up in the first 4 hours to 10 days. It stays elevated, but in the first 24 hours, actually after 24 hours, the CKMB goes up, LDH goes up, AST also can go up. Q waves, which we're just talking about, the Q waves. If you have lead 2, 3, and AVF, that's an inferior. And if you have a V4, V6, that is a left circumflex infarct. Okay, so pathology of the heart when all this happens. In the first 4 to 12 hours, you get wavy fibers with edema. In 12 to 36 hours, you get coagulative necrosis and neutrophilic infiltration. And then 5 to 7 days, you get macrophage infiltration and phagocytosis of dead cells and formation of granular tissue. 10 days to 2 months, scar formation. So you want to treat this right away so you can stop some of that. This can lead to, after got all that, leads to complications. You can get arrhythmias. That's what this is here. Which then you need to do, cardiogenic shock. Pulmonary edema. Dressler syndrome, which is it results in fibrous pericarditis. And then you get infarct, which is an expansion or extension, thromboembolism. And you can also get myocardial rupture 5 to 7 days after the myocardial necrosis. So those are things to look at. Also, contractile dysfunction. So keep all those things in mind when having somebody with Levine sign and a myocardial infarction. Treatment is thrombolytics, coronary angioplasty, is good for early MI. Total change in lifestyle and try to change what causes it, but other than that, that's what you need to know.